All right, good morning, everybody. We're going to start in just a second. People are filtering in, but why don't we get going? Because you're not really here to see me talk. You're here to see. Sorry, distracted there by apparently YouTube was showing me back to myself. But why don't we get started? So good morning, good morning, good morning. Welcome to BARI Conference 2021, Building Back Smarter. It's a joy to have you all here. Sadly, I cannot actually see you. Miss you all. It's been a couple of years since we've been able to do this in person, but I can see, and we can all see your names on the attendee list. And great to see familiar names, great to see new names. I'm really happy we're all here together, if not physically, but it's our annual opportunity to learn together, to share our work, and to brainstorm what questions and solutions to attack next. It's also our 10th anniversary. I'm going to say that again because it's just sinking in for me, and I hope for some of you it's kind of shocking as well. We've been doing this for 10 years, and that's true for BARI, but I think it's true for just sort of the broader ethos of this thing that we've all been doing together. I was reflecting on this the other day and kind of remembering what I was doing 10 years ago, which was taking the red line down to City Hall and wandering around the Menino administration, just kind of pitching anyone who would listen to me on the promise that existed at the intersection of data, research, and policy. And back then, on some days, some people listened, and most often I was just kind of jawing with Nigel Jacob and Chris Osgood and Alvaro Lima, some people that many of you know. And at that time, it was just sort of, it was an idea. It was an imagination we all had, some sort of alchemical equation that would just transform cities and communities. I'm not sure if we've gotten any less grandiose in our arguments, but I think we've seen a lot of success. And so many of the people who felt the same way then are still here, and we've picked up a lot of friends along the way. And so here we are, and it's 2021, and we've had a lot of breakthroughs. We've had a lot of contributions, I think, but also right now there's a really crucial moment facing us. So stepping away from the fact that it's our 10th anniversary, here we are in 2021. We're just emerging from the darkness of a pandemic. We're at a new inflection point in reckoning with legacies of racial inequities. And we have a mayoral campaign underway with a historically talented bench of new leaders, right? One of whom is soon going to be Boston's first elected mayor of color, which is just such an exciting thing in and of itself, and so much more in relief when put next to those other facts I just mentioned. So, I mean, what a moment, right? What a moment for the research policy community of Greater Boston to contribute, right? For data and technology to help us shape the society that we want to live in, to be a part of, to hand off to our children. And that's our job. And I love it. I think you all love it. And that is what we do every day, and what this audience is out there to do. And this conference is an opportunity for us to have that conversation and figure out where we go next. So with that, this year's conference really has a two-part unofficial set of themes that were way too long to put in a title, but really looking backward and looking forward. And to be clear, I don't think this is your traditional, right, learning from the past to shape the future kind of trope. It's more about grasping the past, the challenges of the last year, the 10 years plus that have given rise to this community, and the 400 plus years of racial oppression and discrimination that have created that current moment. But then setting an agenda for the future from all of that learning, from all of that experience, from all of that knowledge, and really answering the question together, what can we do? What should we do from where we are standing right now? And that's our agenda for the next 3 to 4 weeks of this conference. And now this theme is going to be clear throughout the schedule, especially for the next 3 Fridays. And it's a schedule we're really proud of. We're really excited as always, and very thankful to all of you who helped us craft it. Now, as you probably know at this point, if you're here, each Friday is going to feature a keynote from 9:30 to 10:45, followed by 3 parallel panels from 11 to 12. Everyone should have the links to each of those panels in advance, so you can room hop if you're so inclined, like in a real conference. And so to summarize, right, we're going to have 9 topical panels, which is typical for us, right, all featuring 3 to 4 talks from local academics, public officials, and representatives of nonprofits and private corporations. As always, these are going to cover the gamut from housing and crime to environmental justice and transportation, lessons on cross-institutional collaboration, and dashboards during COVID. Right? These panels are going to present work from the previous year or from the last year, but they're also going to be an opportunity for the panelists and audience to chart out next steps and really hopefully plan the projects that will be the talks next year. Again, what is our agenda moving forward in all of these areas? In terms of keynotes, next week, we are going to capitalize on our Zoom context by having talks from national leaders in education research, collaborative approaches to climate resilience, and communities and technology all join us, allowing us to learn how others have been innovating in areas that also pose challenges and opportunities for Greater Boston. That conversation is going to be moderated by the president of the Federation of American Scientists, Dan Correa, who holds a unique perspective on how research policy collaborations can drive change, because he actually was one of the founding minds behind the Metro Lab Network, one of our partners here. On May 14th, we will have our 10-year retrospective on BARI with a set of our colleagues and dear friends, and again, simultaneously looking backward and thinking about what happens next. And last, on May 21st, we are going to have a special conversation about data, technology, and research under the next mayoral administration, with more details to come on that. Turning to today, we're going to start with a special session titled Untold Stories, The Many Impacts of COVID. Rather than taking for granted the many ways that COVID has impacted society, we're going to view 8 pre-recorded lightning talks that cover a wide array of these experiences felt here in Greater Boston. This is going to be followed by a conversation between Robert DeLeo, former Speaker of the Massachusetts House of Representatives and newly arrived University Fellow at Northeastern University, and Adrian Walker of the Boston Globe. And they're going to talk about what we've seen over the last year and where we go from here. And crucially, how does the research policy community contribute as we build back smarter? In a moment, I'm going to turn it over to my colleague, Jenny Stevens, Director of the School of Public Policy and Urban Affairs at Northeastern, which is BARI's home. But first, I want to do a few quick thank yous, and then we'll get right to the meat of the program. So first, our sponsors. I need to thank all of our generous sponsors, all of whom are thought partners in the development of the conference. These include the Boston Indicators at Boston Foundation, the Shaw Family Foundation, Mass Development, Northeastern University's School of Public Policy and Urban Affairs, the Initiative on Cities at Boston University, the Heller School for Social Policy and Management at Brandeis University and diversitydatakids.org, the Institute for Quantitative Social Science and the Harvard Data Science Initiative at Harvard University, MIT Connection Science, University of Massachusetts Boston, Microsoft New England, Sasaki, Redbrook, which is an AD Makepeace company, our studio, and BARI's original home and founder, the Harvard Radcliffe Institute. Also, we have some partners who have helped us in developing the agenda and helping share all of this with you all. This includes the Mayor's Office of New Urban Mechanics in Boston, the Sasaki Foundation, the Northeast Big Data Innovation Hub, which is a project of the National Science Foundation, and the Metro Lab Network. Last, and maybe even most important, I just want to recognize the conference committee. We don't have a brochure or a conference program to hand out to everybody, so these folks don't necessarily have their names in writing, but I want to recognize them because they are the ones who reviewed the proposals. They're the ones who helped us continue sharing the work with everybody. And they're the ones who, when we have a brainstorm, they jump on a phone call with me or with David and think through what's going to happen today and in the coming weeks. And these include Amy Sprung from Microsoft, Eric Gordon from the Emerson College Engagement Lab, Esteban Moro from the MIT Media Lab and from MIT Connection Science, Catherine Lusk from the Initiative on Cities at Boston University, Kim Lucas, who is at the Metro Lab Network, Luke Schuster of the Boston Indicators Project, Ted Landsmark, who is here at Northeastern as director of the Kitty and Michael Dukakis Center for Urban Regional Policy, Tim Reardon from the Metropolitan Area Planning Council, Elizabeth Langdon Gray from the Harvard Data Science Initiative, Harvard Data Science Institute, Initiative, apologies. Evan Horowitz at the Center for State Policy Analysis at Tufts University. And last, I want to thank all of you for being here and for submitting your proposals, for being part of the conference as well as attendees. And I need to give two very special thank yous to my team, really to the entire team, but especially Alina Riste, who is a postdoc at Bari, and most importantly to David Braid, with whom many of you have communicated over the last few weeks and months. He is Bari's program coordinator, and he is essentially the executive producer for this conference, and he is the man who made it all happen. So thank you very much to David for his hard work on this. So with that, just a reminder, we are on Twitter at Bari2020 and at Bari Boston. And so with that, I turn over to Jenny Stevens to introduce the panelists, and then we will get going. Welcome, everybody.
Thank you, Dan, and welcome, everybody. Thank you so much for joining. On behalf of Northeastern School of Public Policy and Urban Affairs, I welcome you all and really celebrate 10 years of Bari and all of this innovative, engaged work, community-based, focused, engaged academic work that we at the School of Public Policy and Urban Affairs are thrilled to be a part of and supporting and collaborating with. Throughout the pandemic, I guess I would also acknowledge the innovation that we've all been advancing as we continue to engage in these important conversations in new ways. And I know the Bari conference last year was an exciting new model, and it's great to welcome you all to participate this year in this model of a series of Fridays to get together and talk about and share this important work. I think one of the things that's really important that the pandemic, the disruptive time that we're in with the pandemic has really revealed how so many of the crises that we're facing are interconnected. And we actually realize that when we see these interconnections, we actually are more engaged and able to think about the more transformative changes that are needed to connect them all. And so we I think acknowledge today and this week, this month, this year, that one of the privileges of so many of us, our work that we get to do is to resist this politics of denial, right? That denying that we have structural racism, denying that the pandemic is so bad, denying the economic crisis and the other educational crises that we're facing. So we actually have interconnected crises, and those of us who are focused on social justice, racial justice, economic justice, environmental justice can come together in innovative ways and very productive, proactive ways to resist that denial that is so pervasive. So it's an honor today to introduce the keynote discussion that we're going to have in just a minute. And we are going to hear from two really important voices here in Massachusetts and in the Metro Boston area. A conversation between Adrian Walker, a columnist at the Boston Globe, who has been such an important voice in Boston for decades. I think since 1998, working at the Globe, raising critical issues of social, cultural significance and local and regional issues. And Adrian Walker will be in conversation with the former Speaker of the House, Bob DeLeo, who was Speaker of the House here in Massachusetts from 2009 to 2020. And before that, he was Chairman of the House Ways and Means Committee, and he represented the 19th Suffolk District. And he's currently a university fellow for public life here at Northeastern, and has been engaging with our students and our faculty and different constituents around campus. And it's great to have Speaker DeLeo here in conversation with Adrian to talk about the impacts of COVID and what have we learned and how are we synthesizing and coming together with productive and ways forward, as Dan mentioned, looking back, but also looking forward in this time of disruption. So we will hear from both the conversation in just a few minutes. We are first going to watch a few brief videos, and then we will come back to the conversation. So I'll hand it over to here we go with the videos.
Hi, this is Wendy Wagner-Robeson, along with Dr. Kimberly Lucas, and we're presenting Closer to Home, COVID-19 and Changing Childcare Preferences. Next, please. If you take anything away, it should be, we need to rethink what childcare looks like. Now is the time. Next, please. What we are trying to learn in our study is we are uncovering families' childcare preferences, identify the factors that drive these preferences, and learn how families were handling both work and childcare during the pandemic. Next, please. We did focus groups and interviews with 24 families across the city of Boston in all neighborhoods, mothers, fathers, and non-binary parents. And we had families grouped by self-identifying employment status by either work from home, combination of going to a work site, work from home, needing to be at a work site, or furloughed and unemployed. Next, please.
And we had three major findings. So the first is really thinking through the fact that the experiences and needs of families are pretty distinct when families are either working from home or when they're returning to their work site. The second thing is that COVID-19 has really affected how families think about care. So the fear of either getting or spreading COVID-19 was really salient in our sample. And when families access care, they really start with who they're comfortable with. Their preferences have changed too. So larger spaces, fewer children, being closer to home rather than work, and really a high emphasis on trust and transparency have all really bubbled up for families in Boston. Finally, the ideal childcare doesn't exist. We asked families what they would want ideally and came up with a variety of answers that demonstrate that the main takeaway here is that, we really need to rethink what childcare looks like. Now is the time. Thanks, everyone.
How have stresses of the COVID-19 pandemic influenced the mental health of Boston's residents? I'm Russell Shute, professor of sociology at UMass Boston and clinical research scientist at Beth Israel Deaconess Medical Center and co-principal investigator of the study Living in Boston During COVID-19. The National Science Foundation funded our study at Northeastern University's Boston Area Research Initiative and UMass Boston's Center for Survey Research. In our survey in the fall, more than 1/4 reported their mental health had declined during the pandemic, even more than reported worse physical health. Feelings of being depressed and left out had increased by about 20 percentage points among those we had surveyed back in 2018. Reports of worsened mental health decreased with age, and adverse mental health effects increased with educational level, from just 5% of those with no more than a high school education to 43% of those with a graduate degree. A higher percentage of whites and Asians reported their mental health had gotten worse compared to Black and Latinx respondents. Single women reported more decline in mental health. Maintaining social connections was key. 4 in 10 of those working from home felt their mental health had gotten worse. Those who visited others more frequently outside the home reported fewer adverse mental health effects than those who rarely visited others. Our survey highlights the very different ways that different Bostonians have been impacted by the pandemic. Recovery efforts must take account of the trade-offs between reducing the risk of infection, lessening economic harm, and sustaining mental health.
COVID-19 shines a light on the health inequities of communities of color in the greater Boston area. Good morning, everyone. We represent 4 of the 8 members on the Boston Medical Center Youth Advisory Board, which is an initiative started at BMC in partnership with the BU School of Social Work. Our board is currently evaluating BMC's family medicine department and the health services provided to youth patients, with an overall focus on uplifting the experiences of BMC patients to promote health equity.
Our research question was, what does health mean to you and/or your community? We used the photo voice method for data collection. We captured our perspectives and then went on to analyze them as a group.
To analyze our data, we used the showing method. Below, we have highlighted what each part of this data analysis strategy stands for. Using these findings, we came up with the following themes. 1, taking our health into our own hands. 2, toxic productivity culture. 3, the high cost of personal health resources. And 4, inequitable health policies and services.
And using our show analysis, we made a narrative statement about COVID-19 being a revealing force that highlights systemic inequities, driving individuals and communities to both cultivate their resilience and take healthcare into their own hands in response to government or policy level failures. We want to emphasize that these inequities have long existed, but COVID-19 and the ensuing response have merely highlighted that these deep inequities exist and that the resilience of these communities is necessary. As young people of color, we not only see the effect of the pandemic on us on a personal level, but having to manage the stress of the pandemic brought to us and our families, but also on a structural level. Years of inequitable policy have disrupted access to health for communities of color. So for macro level change, we want to see well-intentioned interventions and policies that are adequate and efficient, because the shallow impact of many existing support programs makes them feel performative. Moreover, we need intentional power shifts to marginalized members of the healthcare system. Thank you.
Hi, I'm Mariana Sarango Cancel from the Boston Public Health Commission, and I'm presenting on mental health care avoidance due to COVID-19 in Boston, Massachusetts. COVID-19 has had a detrimental impact on mental health among the general population. At the same time, about 40% of US adults have avoided medical care due to COVID-19 concern, and in particular, people of color have been found to be more likely to avoid care. Less is known on avoidance of mental health care in the post-pandemic era, so I sought to determine what proportion of Boston residents have avoided mental health care due to COVID-19, and whether there are racial, ethnic, or other inequities in mental health care avoidance. I used data from the COVID-19 Health Equity Survey from the Boston Public Health Commission. Preliminary results showed that about 1 in 10 Boston adults reported avoiding mental health services due to COVID-19 concern on their part or on the part of the provider, and that greater proportions of adult Black and Latinx residents, female residents, those with less education, and those out of work reported avoiding mental health services due to COVID-19. At the same time, respondents with poorer self-rated health or poorer mental health outcomes were also more likely to report avoiding mental health services. To ensure differences between groups in avoidance weren't simply reflective of differences in mental health service need, we used poor mental health in the past month as a proxy for need of mental health services. And we found that there weren't significant differences by race or gender, even while we saw significant differences in those for avoidance of mental health care. Some of the implications of unmet mental health care needs due to the pandemic include poorer mental health outcomes, poorer behavioral health and quality of life outcomes, and an exacerbation of racial and socioeconomic inequities. And they really highlight the need to look beyond traditional healthcare delivery models that are accessible by all, and in particular those groups that are more likely to avoid services even after the pandemic has ended. Thank you.
Hi, my name is Erica Kangas, and I'm VP of Engineering at Doe, which is a Boston-based startup with a mission to drive purchase power to women-owned businesses. I'm here to talk about the impact the pandemic has had on women-led businesses, approaches to supporting women-owned, and some outcomes from our work at Doe. The pandemic has had a disproportionate impact on women-owned businesses, and especially women of color. This is due to many factors, including lack of in-person events, loss of wholesale contracts, and supply chain challenges. With the onset of the pandemic, many merchants shifted online. In theory, this should have had the potential to open up new sales opportunities for sellers. But the reality is that due to the very nature of their design, many of the e-commerce systems that we as shoppers engage with can actually result in inequitable dynamics where often it's winner take all. One of the most common challenges anticipated for the year ahead is lack of access to capital. And this is an area with significant opportunity for local, state, and national government to support businesses navigating pandemic-related challenges and to ensure a more just economic recovery. We all can have a role to play towards equitable commerce. For shoppers, this can include knowing who you're supporting with your dollars and understanding the impact of the products you buy. For marketplaces like Doe, our work includes improved measurement of who gets exposure and how revenue is distributed. Through innovative design on the shopping experience, we can enable more equitable outcomes for merchants. For policy and government, one solution is better measurement and increased transparency with respect to procurement and spending. At Doe, we're excited to share some initial outcomes from our approach to more equitable commerce, including driving revenue to over 100 women-owned businesses within the first 3 months of launching our marketplace, where 64% of sales revenue went back to brands with underrepresented founders in entrepreneurship. To continue the conversation, find us at joindoe.com or feel free to email me. Thank you so much to the team at Doe, Vanessa Bruce, my co-author, and to all of you for your time.
Hi there, I'm Taylor Petskanik, a researcher at the MIT Age Lab. The oldest of older adults remain at the greatest risk during this pandemic and will continue to be disproportionately impacted by future pandemics and societal disasters. Since 2015, we've convened a panel of research participants ages 85 and older from the greater Boston area. In March of 2020, we pivoted our research to understand how the pandemic is impacting the daily life of this group of active older adults through a series of surveys and in-depth interviews. Here are a few high-level findings as told through a few personas. The first theme is the story of Lane, who felt she was in a group of people at a high risk of serious illness or complications if she were to be infected with COVID-19. She would frequently modify her behavior in order to minimize her risk of exposure because she wanted to do the right thing, since people were giving up their own lives to protect old people like her. Lane lives in senior housing and had seen the virus infiltrate the walls, infecting fellow residents and staff. Can we use a mortality lens in helping older adults to cope after they've experienced a pandemic and/or other disaster? Rob wonders what the total impact of social distancing will be after the pandemic is said and done. He doesn't lie on his surveys. He doesn't necessarily feel lonely, but he thinks he might be more isolated. Rob lives alone in his own home, and the pandemic has eliminated his weak ties in the community. Rob talks about how the pandemic was like the death of a loved one. A ton of people were clamoring down the door to help him out, and he says he probably wouldn't have accepted the help in other circumstances, but now he hasn't heard from anyone in weeks. The check-ins, the socially distant drop-offs, they've all dissipated. How can we reconfigure formal support and better support informal support for older adults both during and after a period of crisis? For many participants, the pandemic has also changed the timing of certain later life transitions, most especially that associated with housing and taking on care. Take Millie, who had been contemplating downsizing for a while, but the pandemic prompted her to move into a senior housing environment so she could have the extra help if she were to get ill from COVID-19 and have the ability to socialize with others, regardless of the pandemic. Or consider Marcos, who was still working in healthcare and was furloughed during the pandemic. Though others started going back, his never came, and he was pushed into what he considers an early retirement. Thanks so much for letting us share these stories with you.
As the US economy shut down in the spring of 2020 in response to the COVID-19 outbreak, hundreds of thousands of Massachusetts residents lost employment and wages. In response, there was an outpouring of government, nonprofit, and philanthropic interest in supporting residents in need. And while millions of pounds of food were being distributed through food banks and community groups, and economic relief was quickly extended, food insecurity was rising. We needed a user-centered approach that could understand the experience on the ground and was nimble enough to inform policy and implementation decisions in real time. To do this, we implemented a longitudinal survey of 60 Massachusetts households, speaking with each participant weekly from May through August 2020. And what became quickly apparent, despite the extraordinary amount of economic resources being poured into communities, was that relief was not reaching some of our most vulnerable, particularly 3 groups. First, people living on a fixed income of SSI plus SNAP didn't receive any extra assistance in the economic relief packages. They also used to supplement meals for free outside the home at senior centers and church events and with school lunches, but now needed to use their fixed income to pay for all the meals themselves. And grocery prices have gone up, particularly at local stores that are easiest for people with mobility challenges to access. Second, undocumented workers who lose their jobs are ineligible for unemployment insurance and most other benefits and have close to zero income. We estimate it is likely that at least 20,000 such households in Massachusetts are experiencing extreme economic distress. And finally, while the direct food assistance outreach was great, it often did not or could not adequately address specific health needs, such as allergies or diabetes, leaving those with special dietary needs especially vulnerable and with little dignity in meeting this basic need. Lessons learned in this project demonstrate how including user experience in a formal way is critical to developing policy that achieves its intended outcomes.
Hi, my name is Roy Wada. I'm from Boston Public Health Commission. Today I'm presenting the findings from a study we did regarding long-term care facility and the COVID-19 mortality in the city of Boston during the recent pandemic, with special attention paid to racial ethnic differences. The reason is that long-term care facilities associated with higher COVID-19 mortality among elderly and white population. We obtained data, case level data from the MAVEN base population from American Community Survey, and then we estimate the population level estimates of mortality rates due to the COVID-19. So this is unadjusted of the accrued rates. There has been total 1,361 deaths in the city of Boston. Population rate is 361 per 100,000 Bostonians. And then I'm just going to mention the period 1, which is the first 4 months. It has a much higher mortality compared to the period 2, which is the subsequent 8-9 months. And then clearly the most of the mortality were concentrated during the first 4 months, which was the first surge in COVID-19. So once we adjust for the differential distribution of population across age and racial ethnic groups, then clearly Black and Latinx population have almost twice as high chances of dying from COVID-19 as compared to the white population. And then if we look at the odds ratio, the Black and Latinx has an odds ratio 1.7, 1.8, 2.4. So 2.4 means 2.4 times as likely to die from COVID-19 compared to the white population. Asian results are a little bit noisier, sometimes less, sometimes more. However, once we exclude the deaths associated with the long-term care facility, then the results are much cleaner, stronger. So Asians are consistently 1.5, 2.3 times more likely to die as compared to the white. Black, so previously it was 1.7, now it's 2.4. Latinx between 2.0 and 3.1. So bottom line, it's important to look at the long-term care facility residency if you're computing COVID-19 mortality across race, ethnic category. And then I would like to thank Dan Dooley, Darren Masters, Mariana Sarang with Council for being great co-authors. Thank you so much.
I'm sorry, I was talking and I was on mute. I wanted to say that it's a pleasure to be here with everybody today, and a pleasure to be part of Bari's 10th anniversary conference, and to be here with the former Speaker of the Massachusetts South, Robert DeLeo. And Mr. Speaker, if you're ready, I'd like to ask you a couple of questions. There we go. I think you're still on mute.
How's
there
that?
There we go.
Okay.
Perfect.
You sure you want to ask me questions?
You thought you were all done dealing with me, but not quite. Well,
it's great to see you, by the way, Adrian.
It's great to see you too. Great to be with you. We've just seen all those presentations and realized just how broad the effects of COVID are going to be. But before we get into that, I just want to ask, do you think we were as well prepared as we could have been for this pandemic?
What's that?
Do you think we were as well prepared as a state as we could have been for this pandemic? I mean, nobody saw this coming, but
No, probably not. And I almost likened it to probably what's going on relative to climate change, or global warming and whatnot, although both very, very serious issues. But I question, as you know, when we talk about issues up at the State House or the budget, when you talk about issues, whether they may or may not happen, the focus probably doesn't go on to them as much as other issues that people are concerned about, such as, are we going to have enough money in our local budget for police, for fire, for education, and whatnot. So bottom line, I don't see that we were as well prepared as probably we could have been or should have been, but I don't think anyone saw this coming in the extent that it did. I think the other issue that we had, in terms of the leadership from Washington, shall I say, I'm not sure if it was taken as seriously as it should have been from the very beginning. And I think with that, we could have done a better job.
I know that you were in office for quite a bit of this, and of course you have longstanding relationships with virtually everybody who's been involved. So I'm not trying to put you on the spot here, but how well do you think state government has responded, and other levels of government for that matter?
What's that? I'm sorry.
How well do you think government did in responding to this crisis?
I think once the issue became clearer in terms of severity of it, once we saw the number of sicknesses and the number of deaths, I think government responded as quickly as possible. I think the biggest issue wasn't so much in our response, but more in the preparation in terms of getting that response going a lot earlier, so that possibly more lives could have been saved and more illnesses could have been prevented. That's where I saw that we had, much of the problem. I would say that when you took a look at the issue, I mean, it was amazing in terms of how much it consumed our time, rightfully so, up at the State House in terms of how we would just generally do our business. Not to take away from the healthcare and the food issues and mental health and whatnot. But first of all, we had to spend about a couple of months or so just talking about how it was that we were going to meet and how it was that we were going to, bring action back to our State House, pass legislation, and do whatever we had to do, as well as our cities and towns. So we found ourselves probably in a couple of months, in addition to concern about, obviously, COVID-19, worrying about how it was that we were going to get government back into action to do the things that we had to do, not only to prevent what was going on with COVID, but just to regulate the general, or run the regular business of government here in Massachusetts.
Do you think we shut down soon enough, and do you think we opened up too early?
I think that that's a great question. I don't think we shut down probably soon enough, because again, I think it all goes back to preparation. In terms of what exactly was going on. I don't think that people understood at the beginning the severity of this. I don't think that this was much more important or an issue to discuss and to address than the common flu, so to speak. And I think that obviously, again, going back to preparation, I'm not sure that we did things early enough. In terms of time-wise, I found that the uh, I got calls on both ends of the spectrum. What are you doing? Why are you closing? Why are you, to the other side? Why are you opening? So people had various opinions. I think that the basic approach by the governor and the legislature to slow things down, I think we were more conservative, I think, than other places, I think was a good call. And although people were anxious to get back to their usual way of living, I think that the right thing was done in terms of the slower approach.
Of course, we kind of had parallel crises going on at the same time. The public health crisis of COVID and also the social justice movement that really erupted after the killing of George Floyd. I mean, there were demonstrations right in front of the State House. What was that like to live through as a municipal leader?
And that's where I get into one of the issues, that when you're talking about all of the issues that happened, which were just discussed, I think we had the regular role in terms of what was going on. I think the fact was, and what was good about it was the fact that in terms of George Floyd, which wasn't good in terms of obviously his killing, but was the fact that it spurred action, especially here in Massachusetts. I was very proud to see that despite the fact of what was going on with COVID, that we here in the Commonwealth of Massachusetts were able to get a strong policing bill done to address some of the inequities that were occurring, I think, within the police department. We talked about the fact of certification, decertification of the police. We talked about the fact of a commission that was going to go back and to talk about many of the same issues so that police will be more educated in terms of how they will deal with certain situations. So I think that with that, I think the more education, the more that we brought to our police in terms of race relations, in terms of those with mental health issues and so on and so forth, I think was important. And I do think that we did a good job relative to this. But again, I think because of COVID-19, maybe wasn't as fast as we could have done. But on the other hand, I was very proud to see that Massachusetts, I believe, was one of the first states to get something done. And most importantly, Massachusetts was one of the first states to getting something done relative to getting real reform in our policing.
Do you think
But if I could talk one other thing about policing, and this is, I think, one of the issues that I'm hoping that those of you who may be watching or taking part in today's seminar will realize is the importance of information and data relative to policing. One of the things that I was thinking about as George Floyd, and I was happy to see, obviously, the verdict, and I was happy to see that justice was served. But on the other hand, what I'd like to see come out of this is, despite the fact that we had some time of joy, and is why? Why did this happen? Why are there tensions between the police department and citizens? I think that this doesn't end with a guilty verdict for Lieutenant or Officer Chauvin, okay? This is just the beginning, I feel, in terms of how we're going to improve upon those relationships. Why did this happen? Why is it just about every week we're having some type of tension between police, and its citizens? I think that most importantly, I think that's where some of the folks who may be taking part in today's event will hopefully do some study and do some research to get some answers to these questions.
Well, one of the arguments that's been made is that there's simply too much policing, that we rely on police to do too many things, that they are involved in situations that might be better handled by others. Did you see any of that data while this debate was going on? And What do you make of that argument?
Yeah, I did actually. Not so much during the debate, but probably a little bit before. We did a criminal justice reform legislation, for instance.
Yeah.
And I have to tell you, there's a great example of research and data, technology coming together to move us relative to taking a look at our criminal justice reform legislation. Now, what did I do as Speaker of the House at the time? I called upon a friend, former Chief Justice of the Supreme Judicial Court, now a professor here at Northeastern by the name of Roderick Island. He and I dealt with each other, in terms of working between the court system and the legislature. We found that we worked together very well, and I think we made some great progress. But it was Rick Island that I looked to get some information. And one of the things that struck me right off the bat was the fact that we had, 40, 50% recidivism in our courts. Out of all the issues that struck me, that's what struck me the most. And that's what I think propelled me to say, wait a minute, this is wrong. There were a whole lot of issues that were going on and whatnot. We had issues, for instance, with the Corey. We had issues with minor misdemeanors that people were having records for. We had issues in terms of the importance of expungement. And this is what I was learning from Justice Island. I think that, again, made our changes that we had in the criminal justice reform issue so important. And these were the issues that, again, the people who are watching here today showed that it was important to me. What did I learn? What did I learn from some of the information that they were providing to me? What I was learning was the fact that when a person spends some time in jail, when they get out, there are issues relative to housing. Many of them had no places to go.
Right.
Many of them did not receive the education they should have been receiving in jail. Many of them had no places in terms of work. And why was that? Probably sometimes because of a Corey record, a somewhat minor violation that was on their record that was preventing them from moving ahead with their lives. And as a result of that, with that information that we took, I think that we were able to address many of those issues. Some of the issues stemmed when they were minors, for instance, that again should have been either expunged or, considered as no crime. But I've got no issue in terms of the so-called bad people being put in jail. But what I also saw is, especially as I visited with Jack Larrabee, with some of these homes or places where people are trying to get the start, halfway houses to get their lives and their start back together. And I spoke to some of these folks, and I learned, that they wanted to get that opportunity, that they wanted to get their lives set and straight and get back on that parallel of being a productive and good citizens. But they needed some assistance. They needed some direction. And I think that most importantly, as part of the policing, as part of the criminal justice reform, I think that was, that really helped us. And it was there that I really looked to someone like a Rick Island to say, okay, you started in the juvenile court, first of all. What's happening, in the juvenile life here? What can you tell me? How can we put those people on a better path? What can we do? So I think that, and I have a couple of other examples which I'll talk to you later if you want, because I'm probably talking too long now. Where again, I think that what I learned as a result of research and data that was provided to me really led me to, I think, become a better speaker, a better legislator, in the sense that I think I was more informed of what I felt at the right avenue. And that's what I'm hoping with this pandemic. You know, the biggest question we can all have, and we saw some unbelievable videos, is that when you talk about this and the issues that were brought up were fascinating. You know, the economy, what's going to happen with the economy? You know, the restaurants in particular were hit, you know, very hard. The retail stores were hit very hard. I saw where, just reading yesterday in your paper, they're doing now a story on some of the different parts of the community of the city of Boston. I think Fields Corner, I think, was highlighted in yesterday's article, and they're going to talk about other areas of Boston. Well, what are we going to do about that? You know, a couple of weeks ago, maybe even a month ago now, in Ted Landsmark class, we had a conversation relative to what was happening in Nubian Square, for instance. Well, how can we turn some of those negatives around to positives? What type of economic development assistance can we give these folks? You know, I think that's so important, not only there, but you know, throughout the whole city. You know, the hospital care. What's going to happen relative to hospital? A lot of these people have put on their treatments, as was just stated earlier. They put some of those treatments off. I'm especially concerned about mental health. I've always been concerned about mental health. Why am I concerned about mental health? Is because one thing that I had learned is that the people weren't getting the mental health that they required. And one of the big reasons they couldn't get it was the fact they couldn't access it. I would get calls from some of my constituents, some people from outside, and said, you know, I'm trying to get help, especially for a child that, you know, that they may have, but I can't get through to anybody. They want my area code and everything else. And by the time, you know, I try to get through, you know, worse things can happen. And, you know, and that's you know, a problem. Transportation. Are we doing enough for transportation? The people who need the transportation probably more than anyone else, you know, are the people in the poorer communities. And now we're talking about cutting off bus services and whatnot. We have to make that, you know, that investment. Food insecurity. I can tell you that just in my district in Revere, in Winthrop, the number of calls that I got in terms of the enormous increases in terms of people who are now waiting in lines just to get food and was to just to live, you know, increased greatly. Education, you know, the remote learning. Were all students prepared for this remote learning? Or were they not prepared? Were the students in some of the poorer communities, did they have the access to computers and the like that others had? Or did they just go away and they just lost so many months of education? So, you know, again, I think probably the underbelly was the fact that, you know, the effects of the poorer communities and what we can do to bring those folks back faster.
Well, I mean, I think one thing we've seen for sure is that COVID and this entire crisis has exacerbated every kind of inequality, right? So let's talk about economic inequality and the way poor people have gotten hammered. I mean, I did a bunch of columns during the course of this on Chelsea, which is, just outside your district and right near your house.
I was just going to say, not too far from me.
Not right down the street from you. And how
the
people
town manager was a former mayor from Revere, so I'm well acquainted with Chelsea.
That's right. I mean, how do we use the levers of government to begin to address what's happened to poor people as a result of this pandemic?
I think what we do relative to, in terms of accessing government, first of all, is funding. I think our biggest issue, one of the issues I should say, is funding. What's going to be happening, first of all, with the federal funding? What does it mean? You know, I don't think we're sure on that. I know the House in their budget didn't include this issue because they feel it's something we have to see in terms of in terms of what's going on. I think it's important in terms of funding. I think it's important in terms of, again, building up those economic situations, those economics at different parts of the city or in places like Chelsea, that we can help and that we can get people and help people get back to jobs. The transportation issue, I think, is important. The healthcare, we have to talk about healthcare. We have to talk about community health centers, in terms of a place in which people can get here. The attempts that we sometimes have in terms of mass health to dilute the care that some of our poor communities get. We have to keep on, fighting that. Education. I can't tell you how important that I think that early education is something which that is I put great emphasis on in terms of since I was speaker. You want to talk about an issue of importance in terms of early education? Take a look at some of the facts that have been demonstrated by some of the polls and some of the findings, that those with early education, by the way, don't have the same issues relative to incarceration than those without early education. An amazing statistic. Again, an example of what I've seen relative to the importance of research and the like. Community colleges. I look at education, first of all, is probably the great equalizer. So when you're talking about places like Chelsea or some of the poorer communities, the opportunities that we give them in terms of improving their education, I think is really important. Take a look at Lawrence. What did we do in Lawrence when we had the former Commissioner Riley? Commissioner Riley, when I spoke to the commissioner at the time, was telling me about the low graduation rates that they were having in Lawrence. Okay, he brought on a person to improve those rates of graduation. And what did he find? And if I'm sorry if my numbers may be a little bit off because it was some time ago before he was commissioner, but I think they increased by 15% just in the city of Lawrence in terms of graduation rates from high school. So these are important investments. These are good investments. These are what's going to lift up the people in some of these communities. These are the investments that are going to be good to the Massachusetts economy. As we're getting people back to work, we're getting them into good paying jobs. The environment, for instance, one of the proudest things that I was glad to see about the climate bill was the environmental justice aspect of the bill. Now, why is that? I live in Winthrop. I live, I represent Winthrop in Revere. Obviously, we have a sewage treatment plant. We have an airport in East Boston, not too far away. As we're going through the tunnel, we're going through a whole lot of traffic. And what I find it many times is the fact that some of the poorer communities are faced with a disproportionate concern, relative to, environmental justice. So I was glad to see this. I think we've got to keep our finger on, what's going on with DCF, for instance, to make sure that those children who are under the care and control of the Commonwealth are cared for. Okay. I have to tell you the things that have broken my heart as speaker. And before that, when we talked about the deaths of the Jeremiah Oliver, Bella Bond, David Allman, for instance, just to name a few. I think it's good to see that some of the major businesses are now making investments in terms of communities of color. I'm hoping that the next step will be obviously to talk about the hiring and putting to work and providing opportunities for some of these folks as well. I think that's the way that we're going to get more equalization in terms of what's going on with the various communities around the city, and that's the way that the so-called communities of color or poor communities, however you want to, whatever adjective you want to use, can increase and improve upon themselves.
What are some of the ways you think state government or any level of government could use data better to inform decisions? You talked about how data kind of helped you in shaping your views on criminal justice. What are some other areas where it could be having more of an impact than it's having?
Well, for instance, we talked about criminal justice reform. We talked a little bit about the education reform. How about guns? When I tried to introduce the bill relative to gun legislation here in Massachusetts, a piece of legislation, I think, which took me a couple of years and wasn't as easy as I thought it was going to be, even here in liberal Massachusetts. You know, when I first, I can remember driving home from Sandy Hook and Springfield and driving home from Springfield and hearing about the Sandy Hook incident, and I couldn't get out of my mind the fact that you have these children who are just huddled around in a corner, you know, with this person just shooting at them. In addition to that, you have a situation where you have you know, in addition to the mass shootings that were going on, we had the everyday shootings that were going on. You know, whether it's one or two or three or four people, whatever it was, that probably didn't receive the publicity that the mass shootings were going on. Look what happened in Dorchester, I believe it was just a couple of weeks ago, where that grandmother, you know, happened to be in the vicinity where some shooting was going on, and she became a victim. But what did I do there? What happened when I found that some of the difficulties that were going on, what the members were hearing, the pressures they were hearing, and I'm not sure that the polling was bad on this issue in terms of people looking for more control over gun violence. I think the fact was that they were a lot louder. They were a lot more vocal, especially with their elected officials, in terms of, you know, how do we control gun violence. But again, I went back to talk to Professor McDevitt from Northeastern University, who had done a lot of studies, who had done a lot of research in terms of how we can improve upon what we do relative to gun violence, what we can do here in Massachusetts. And it was great to hear, you know, President Biden talk about in his address the other night the importance of addressing some real basic concerns, I think basic legislation relative to gun violence. But I will tell you, Adrian, that, you know, we as a society, we as a country, until we're going to see some real action on some of these issues at the federal level as well, that we're not going to be able to see some of the improvements that we like to see relative to gun violence. Sure, things have improved here, and I think in statistics have shown, talking to my friend John Rosenthal, who I spent a lot of time with, and John was very pleased with some of the things that we're able to accomplish. But until we get some of our neighbors in some states across the country to hear us, which I tried to do at some of the speakers' conferences and whatnot, until we can get some real action on that, you know, we're not going to see that improvement. But again, I think that were it not for the research, were it not for the data provided to me from a Professor McDevitt, for instance, or maybe some of the other folks who may be working. You don't have to be a professor to be in the business of working with political leaders or non-political leaders to get things done or to get things changed. But I think the work is so important.
You know, we've talked a lot about government, but let's talk about higher education and institutions like Northeastern. What are some of the things they can do in this moment? You know, this exciting moment where everything feels like it's on the table, and, you know, there's this opportunity for real social change. What can institutions of higher learning do to be part of this process?
Yeah, just as important. I mean, the folks that we heard earlier were from various schools of higher education, and they provided us with some information, you know, and some of those videos in terms of some of the facts that they had found. I think one of the issues that they emphasize considerably the fact about communities of color being hit harder. Sure, COVID-19 hit everybody. It affected everybody in some ways. But some people, a lot more than others. And that's very disconcerting to hear in terms of what, some of the findings that they had. But when it comes to what I've learned since I've been at Northeastern's a lot more than just teaching or other schools of higher education. They're a lot more than just every Wednesday from 2 to 4 teaching a class on whatever the subject may be. What these professors and others go through in terms of the study that they do, the research that they do, that's the important thing. That's one of the most important things that we can see happen, so that we can get that information. We can get that good information, okay, such as I learned from McDevitt, that I learned from McIsland, that I learned relative to early education by reading a study from somewhere, that we can take that so that the decisions can be more informed and more effective. It's great to say that, we had COVID-19 and presented some problems, and, these are the things we've got to look at. But these folks have done some real educated studies and came up with some real facts and figures that I think can better give the materials to decision makers and the like that can help us move along.
Right. And we're starting to get questions from the audience. So I wanted to ask one. The one question we've gotten is, in terms of preparation for COVID, data like that compiled by Boston Indicator showed that environmental injustice and lack of affordable housing were major problems. How does that bear on the idea of preparation?
Oh, I think it's, again, in some of my thoughts, I'd have to say that, when you talk about what it was housing and what was the other issue, I'm sorry?
Housing and also environmental injustice.
Environmental justice. Okay, first of all, when we took a look at the climate bill, one of the most important things that I saw that we had to do was to address the issue of environmental justice. And I was glad that Representative Matero from East Boston, a neighbor of mine, and we share a lot of the same concerns in terms of airports and tunnels and the like, in terms of making a place like, but East Boston isn't unique to some of the issues that are going on in the city in terms of environmental justice. And what was interesting, what we have found is that when you talk about environmental justice, it seems like it's the poorer communities that are bearing the biggest burden of so-called environmental justice. It's the poorer communities that are probably dealing with the issue in terms of pollution and whatnot. I can tell you, just living in a place like Winthrop, there are many mornings, especially when it gets warmer and the windows may be open, that I don't need an alarm clock. I go by the alarm of a plane which is starting up that wakes me up, each morning. And housing is more important now than ever. One of the concerns that I have, as I see what's going on in Boston, and I've talked to Ted Landsmark on this as well, is the area of gentrification. I'm really concerned. I see, some of the folks in East Boston, for instance, where I had growing up, some of whom were being forced out of that because of housing costs. That's why I think affordable housing is important. We just passed the Housing Choices Bill, which was one of our hopes, was that in many of especially the gateway communities, that we're going to be able to see more affordable housing, and that's probably yet to be seen, and hopefully it will be seen. But those are two very important issues, especially for people in the Boston and the greater Boston area.
There's some talk that cities are going to get reshaped as part of this. That people are going to be less desirous of living in cities, particularly rich people, with more options and that gentrification could slow down as a result. Do you think that will happen?
That gentrification will slow down?
Would slow down. What do you think the effect of COVID will be on cities?
You know, it was interesting, and I was very concerned relative to gentrification in terms of what was going on in the city. There seemed to be, after somewhat of an exodus in some places in the city, there seemed to be a whole lot of folks who just had an interest in coming back into the city. And well, for instance, in East Boston, you have and you can afford some of these places that are on the waterfront and whatnot. You know, that's a beautiful place in which to live. And I was amazed to see as I would go to some of these places around, is it the Millennium or something like that, where someone was one of those places, and I was talking to someone there, and they were saying is every floor that you increase, it costs you an extra $1 million. And to me, that was just mind-boggling, you know, to me. But I feel, anyways, that look at one of the things I've tried to spread around or to get out there was the fact, especially with economic development, that a lot of that economic development is in the Boston and Cambridge area, and I want to see us looked upon as a Commonwealth. I want to see us looked upon as a Commonwealth, so that when some of the folks that may be talking like expanding, who have offices down at the seaport, maybe they'll look to a Springfield, maybe they'll look to a Berkshires, so that we can see some of those jobs and some of that wealth spread throughout the Commonwealth. But in answer to your question, no, I think that I think Boston has a lot to offer. I think there has to be a transformation. I think there has to be a transformation in maybe some of the different parts of the city. What I'm hoping is going to happen is that transformation that I talked about in various parts of the city are going to draw people to other parts of the city that they may not have decided to go to before. But maybe with some of those funds, maybe with some of that economic development that we may see, maybe that issue that I read yesterday relative to Fields Corner in terms of what's going on there, maybe that diversity, maybe the changes that I heard in Ted Landsmark case relative to Nubian Square. Maybe it's just not going to be towards the North End here. Although being Italian, I probably shouldn't talk about business off going to the North End. But maybe we can spread that around a little bit more. So I think, anyways, that with time, I think we're going to come back bigger and stronger than ever, because we're going to be a different city. We're going to be, I think, a more diverse city, and I think that people, from all over the city are going to have opportunities they didn't have before. And I think that as a result of that, it's going to be a better city.
Well, as a person who's lived here all your life, what do you think it will mean for Boston to have a person of color as mayor?
I think it's great. Actually, I happen to know all of the candidates. I can't say some I know probably better than others. But I think we're at a time, and I think that it was a time whose time has come, so to speak. And I think that everyone seems to be a quality candidate. Boston's a whole different than the city that I grew up with years ago. When I grew up in the 60s and whatnot, it was a city of, I had grown up in East Boston. It was primarily Italians. Okay, we had a smattering of Irish people, a smattering being about 5 to 10%. The North End was the same way. You go to Southie and Charlestown and whatnot, and sometimes you weren't terribly welcome there. Irish communities and and now that's changing. That's changing, and one person said to me, they said, when I grew up in East Boston, there was one language that I heard, and that was Italian. Now, when I'm in East Boston, I'm hearing various dialects of the, in terms of Latino and Spanish and whatnot. And I think it's good. And I think that the good part also is that there are a lot of folks, good candidates who are running with the right ideas. I think it's going to make a much more, probably, and I think, the mayor did a great job, Mayor Walsh, in terms of trying to make it, inclusive community. But I think that probably with the change in the city, with the different ethnicities, with the different colors and whatnot, I think it's important that, and I think it's good that the next mayor will be a person of color.
What are 3 things you think government should do to increase equity?
What can government do?
What are like 3 concrete things, say, state government could do?
I think first of all, I think that I think it was important what we did relative to police reform legislation. I think that was sending an important message in terms of any inequities that we saw relative to how certain matters may be handled. I think that was that was important. The other thing I think that we can show relative to important is to provide educational opportunities and to help our city provide better educational opportunities, whether it's in preparation, whatever it may be. And that also, again, includes increasing our role relative to early education, which I hate to keep on harping on, but that is very important to me. Investments in our community colleges, so that people who, because of financial needs or other issues, may not have had the opportunity to increase their education. And and quite frankly, the issue of finance and support, whether it's through foundations, banks, or whatever, so that businesses, that are owned by people of color now will have a better opportunity in which to thrive and to grow and to employ other folks from that particular community. So those are just some of the issues I think that we can do here in Boston to improve. And I think, with time, I think it's going to take just a different mindset, and, in terms of how people look at each other. This may sound a little bit corny, so to speak, but I think that that's so important. But I think that's happening. I think it's, I see it happening. I went to that Latino restaurant. That wasn't bad. Talking to the folks, there, and it was an eye opener to me that we can and we should be one people, and I think that type of mentality, I think, is coming to the city. I think it's important that it's coming to the city. And I think I think that's one of the reasons why I'm so optimistic about the city in the future.
What do you think a successful COVID recovery would look like? Where do you hope we'll be 2 or 3 years from now?
What do I think that, well, in terms of a successful COVID recovery, I think it has to, first of all, include an aspect of making sure that should we fall into this situation again, whether it's through COVID-19 or whether it may be through global warming or whatnot, that any type of disaster type of situation, that we start giving a thought to now, that we start making sure that we are prepared for the future. I think bottom line, when it comes to the COVID, it's the question of what you learned what we learned relative to our care for the elderly, for instance, that we can carry through into the future. What do we learn relative to, what was going on maybe in some of the communities of color, some of the poor communities? What could we have done better in terms of making sure that they were that they received enough information or enough testing results, enough teaching results, so that they would understand the importance of getting the vaccine, for instance. So I think the most important thing that we can do is that relative to learning from our past mistakes and how we can improve upon that so that we can be better prepared for the future. And I think that, again, I hate to keep on harping on this but with the audience that we have out there, these are the folks I think who can bring some of these answers and make them a lot clearer and think of a lot of other things that I may not be thinking about or that I haven't thought about. And I think that that's what I learned as Speaker of the House, and now what I've learned even more now being involved in the university system, that working together, which probably we didn't have great success in the past, but I think working together, some of these answers that maybe the political leaders or other leaders are looking for, with the right type of research and the right type of partnership, shall I say, we can make our state a better state to live in.
I wanted to ask one more audience question. This is from Stephanie Harden. It says, there's been a lot of recent reporting in the Boston Globe about ongoing police misconduct within the Boston Police Department. At the same time, high-level members of BPD have publicly resisted police reform while insisting that the policing issues presented elsewhere, as in the George Floyd case, are not present here. What are your ideas about how to change the culture of the BPD in order for reform efforts to be successful?
Look at, some things which I've talked to a lot of policemen who have talked to me about, their concern in terms of some of the new rules and regulations that we have. You're a good police officer. None of this is going to make any difference in terms of your daily role as a police officer. And I have to say that the highest number of priorities are good people in terms of running or being involved as police officers. But I think it's important to them. I think it's important to obviously the city to have confidence in our police department. And I think it's incidents like the George Floyd situation to really say, when I hear people say that, well, yeah, that's Minneapolis, it's not Boston and whatnot, but there's a learning moment there. There was a learning moment there in terms of what can happen, when things get out of hand. Stop and think about it. Stop and think about what we do relative, whether chokeholds are allowed or not allowed. Let's talk about the no-knock warrants that were occurring. So these, again, the things that I learned, again, through criminal justice reform and the police reform legislation that we can improve upon. Policing, is different now. In police, are learning different things. They're learning better. I can tell you when I was dealing with domestic relations cases, probably domestic relations violence, probably over 50% of the cases that police call have to do with domestic relations. But now we have a better educated police force, I think, relative to domestic relations. Mental health issues. Some of the issues aren't so much of, hardened criminals, but issues of those who may be having mental health issues. How can we improve upon that? So whether you're in Boston, Minneapolis, or whatnot, these are areas that would further education our police officers. I think we can make the state safer, and most importantly, I think that we can make it a safe a place that people can be proud of.
Well, I hope there is success in this idea of bringing together government and academia. I think there's a lot to be learned from each other, and I'm very glad that you're at Northeastern working on this. So it's been great to talk to you.
Nice to see you. Thank you, and to thank you also, by the way, to to Dan for a great job, and Jenny for great job, but Dan O'Brien in particular for not only doing it today, but I didn't realize how long this has been going on, the ongoing conversations. And again, just to finalize one thing, I think it's important, folks. If you didn't hear from me once, you heard it from me 10, 20 times. Again, how working together, whether it's the policymakers or the folks who are doing the research and whatnot, we can make things better in our city, in our state, and in our country.
Thank you.
Thank you. It's great to see you.
Well, those are perfect closing remarks, Speaker DeLeo. Thank you so much, and then thank you, Adrian, for sort of leading us through that chat and asking such great questions. And that was just really inspirational, and I think a great way to kick off what's going to happen next in this conference and the next few weeks, and the kinds of conversations we can have, right? Early education, transportation, police reform, economic recovery. You really covered it all. Public health, and that is our that's our mandate, as it were. And so thank you again for helping us kick things off here. To everybody, so that conversation was live streamed on YouTube. So if any of your colleagues or friends missed it and want to see it, we'll be posting it up there in the next few days. And so anyone who wants to can rewatch it or watch it for the first time. And then just to kind of make sure everyone knows run of show from here, we're going to take a 15-minute break between now and 11 o'clock so that people like myself can go get a glass of water and else can take a moment. And then we're going to have 3 panels this morning, parallel panels, one on innovations in criminal justice, one on how do we build back, when we build back, focusing on questions of housing, and another one on dashboards in COVID. Now note that there are separate links that are different from this one for all of those 3 panels. So there's 3 other links that were sent out last night and also this morning. So hopefully everyone knows how to get to where they want to be by 11 o'clock. And if you can't join us today, join us again next Friday at 9:30 for a conversation on national lessons that we're very much looking forward to. So with that, again, former Speaker DeLeo, thank you so much for the time and the thoughts. Adrian, thank you so much for leading us through this conversation and the great questions. And what a wonderful way to start the conference. Thank you so much for joining us.
Thank you.
All right, and to everyone else, we'll either see you in the panels or we'll see you next Friday. Thank you for joining us as well.